everyone. My name is Lea Mascarenas, and I am a third-year medical student at the LSU School of Medicine, New Orleans.
And I'm Hernandez, also a third-year medical student at LSU New Orleans. Lea and I are co-chairs of the New Orleans Adolescent Reproductive Health Program, or NORM. NORM is led and run by health professional student volunteers who develop sexual health curriculum based on the latest evidence-based information and teach it to youth attending middle and high schools in Orleans Parish in an inclusive and non-judgmental way. Louisiana has a long history of ranking among the states with the highest teen pregnancy and sexually transmitted infection rates. Research shows that comprehensive sexual health education can improve these poor health outcomes. Yet Louisiana does not require instruction about sexual health at any grade level, and many students in the state are left without proper sex ed. NORM has sought to address this disparity by providing school-based sexual health education. However, the COVID-19 pandemic has forced NORM out of the schools and into the virtual classroom. If found to be an effective model of instruction, comprehensive virtual sex ed can expand access for students during the pandemic, and potentially afterwards as well. The purpose of this study was to evaluate the efficacy of our model for virtual reproductive health educational intervention in New Orleans, Louisiana.
So how do we test the efficacy of a virtual reproductive health education intervention? At the New Orleans Adolescent Reproductive Health Program, we did this by administering a comprehensive reproductive health curriculum to 133 middle school and high school age students in the New Orleans charter school system. Students completed 8 lessons with us, covering topics such as gender identity, anatomy, healthcare screening and consent, and so much more. And these lessons were administered live via Zoom, the program that we're actually using to record this presentation today. And using a pre-experimental study design, participants were given pre- and post-test questionnaires comprised of 47 multiple-choice and true-false style questions. The reproductive health questionnaire is designed to evaluate understanding and proficiency in health behavior outcomes as defined by the CDC Health Education Curriculum Analysis Tool.
Now let's see what we found. The mean score for the pre-test taken by students before receiving the virtual sex ed curriculum was 24.81 out of 47, or about 53% correct. The mean score for the post-test taken by students after the virtual sex ed curriculum was 37.55 out of 47, or about 80% correct. A paired t-test comparing the pre- and post-test data shows significant increase in reproductive health knowledge, with a p-value of less than 0.0001. That's a very small p-value, meaning our data are statistically significant. This indicates that the ability to utilize virtual reproductive health education offers schools with the flexibility to provide their students with comprehensive reproductive health when in-person education is unavailable. Beyond the COVID-19 pandemic, this model of virtual reproductive health education may serve students in rural education systems with limited access to qualified reproductive health education.
To reiterate some of the points that Alexis made, virtual reproductive health education is an effective means of providing students with comprehensive reproductive health education in the setting of virtual or hybrid instruction models due to the COVID-19 pandemic. This model can serve as a suitable alternative to in-person school-based reproductive health interventions, and our study also adds to the growing body of literature that has documented positive results as well as increased knowledge after participation in a comprehensive reproductive health intervention. We would like to take this moment to thank Xavier University for allowing us to present our abstract and poster at the 15th Annual Health Disparities Conference.
And thank you to all the sexual health education advocates fighting for healthier, more empowered communities here in Louisiana. If you're interested in getting involved with NORM, please email us at noarhp.lsuhsc@gmail.com. Thanks.